Ladies and gentlemen, this is an article that came out October 5th, 2017 in USA Today. Opioid plague getting worse instead of better. Public health officials warn. I'm going to read through this article, and when I get to the end, I'm going to give some commentary because I really have a lot to say about this one. I'm going to go ahead and play the video.
Welcome back to The Why. I'm Christina Muschler. Last week we talked about some doctors profiting from marketing opioid painkiller prescriptions and in general the role that the medical field can or does play in the opioid crisis. Well, earlier today I was reading a Princeton University study that found doctors who got their training from a lower ranked medical school wrote 3 times as many opioid prescriptions. That's in comparison to those who went to an Ivy League or another top school. The researchers looked at 2 billion opioid prescriptions written between 2006 and 2014 to come to that conclusion. And Express Scripts, that's the biggest prescription benefit company, says starting in September, it will be limiting the number of opioid drugs prescribed to first-time users. Of course, that's in an effort to kind of curb the opioid epidemic and control who's getting these prescriptions. But the American Medical Association is criticizing that move, saying those decisions should be left up to doctors and their patients. So where do doctors really stand in the middle of this health crisis? Dr. Buck Parker, an emergency and trauma surgeon from Utah, he was pretty candid in talking to me about how he says it all started and how he handles addiction issues with his patients today.
One of the big reasons we have this is something that's called unintended consequences. There was back in, and I don't know, you're probably familiar with this, but back in, I think it was 2002, or ish, we started, JACO started making these surveys of hospitals and seeing if patients are satisfied. So these satisfaction surveys, and these surveys turned out to be, the surveys turned out to be something else. It turned out to be a way to penalize hospitals and not pay them as much from the government. And then the hospitals figured out, oh, geez, if our patients aren't satisfied, then we're not going to get paid as much. But we know that patients, when they don't have pain, are more satisfied. So let's, kind of ramp it up and make sure everybody doesn't have pain, which is a good idea and it's a bad idea. Nobody wants our patients in pain, but on the other hand, we don't want them addicted for the rest of their life. So we didn't see this coming, and obviously everyone was acting out of goodwill, really, but that's really kind of what happened. The other, it's, again, the hard decisions to make. And the hard decisions to make at this point are to say, hey, we really screwed up. We shouldn't have done this. Let's help, kind of thing. And let's build these programs for people to come in and get you clean. So I think when I tell that story, not very many people have heard that. And I think maybe everybody should. I would like to say that I'm handling it really well, but I've been kicked out of the room twice in the last couple months for trying to talk, be serious and talk straight to people. They don't want to hear it. I mean, this is how bad addiction is that you say I'm not addicted, and when somebody like me, I see it every day. It's obvious to me that you are, and I say, look, we'd really like to help you. Maybe we should think about tapering down. And I think maybe this the opioid is causing more problems than it's solving for you, and let's talk about this. And they say, some prevent and get out of my room. I don't ever want to see you again, doctor. Give me a new doctor, kind of thing. So I do try to be pretty straight with people and say, I think that this is complicating your current issues or whatever, and can I help you, or let's get you some help or something like that. I try and be very straight with people. Most people, they get it. They understand that I'm trying to help, and I think a lot of doctors are, and then some people don't. But again, it's not a quick fix, and even I mostly practice in the hospital, and I'll sometimes happy to see those people walk out of the hospital because I know it's a very long road to recovery.
All right, ladies and gentlemen, You know, okay, let me just get through the article first. And, all right. A top public health official warned Thursday the nation's opioid plague is showing no signs of abating. It's one of the few public health problems that is getting worse instead of better, said Dr. Deborah Owie, director of the Center for Disease Control and Prevention, National Center for Injury Prevention and Control. Owie and public health officials testify at a Senate hearing described an addiction crisis that has spiraled out of control that is far beyond the scope of any particular agency to address. We need all hands on deck, said Dr. Francis Collins, director of the National Institutes of Health. Officials from 4 federal agencies delivered their dire assessment of the opioid plague during the first in a series of hearings before the Senate Health, Education, and Labor and Pension Committee. The opioid plague is tearing our communities apart, tearing families apart, and posing an enormous challenge to health providers and law enforcement officials. The committee chairman, Senator Lamar Alexander, Republican, Tennessee. More than 11,000 Americans misused prescription opioids in 2016. Nearly 1 million used heroin and 2.1 million had an opioid use disorder due to prescription opioids or heroin, according to the Federal Substance Abuse Mental Health Services and Administration. More alarming, officials said, is this continued increase in overdose deaths, especially those involving illicitly made fentanyl and other highly potent synthetic opioids. More than 300,000 Americans have died of opioid overdose since 2000, officials said. Preliminary data shows at least 64,000 drug overdose deaths in 2016, the highest number ever recorded in U.S. in a single year. At Thursday's hearing, public health officials said federal agencies have undertaken a number of steps to help deal with the problem. They include new programs that strive to improve access to treatment, mobilize resources to increase the availability and quality of long-term recovery, and target high-risk individuals such as pregnant women and jail and prison inmates. Last month, the Substance Abuse and Mental Health Services Administration awarded nearly 46 million in grants to programs in 22 states to provide resources to first responders and those who work directly with people who are highest risk. And yet we seem not to be making any kind of progress we need to make, said Senator Susan Collins, Republican, Maine. Public health officials stress that more needs to be done, particularly in areas of prevention and the overprescription of opioids. Most people become addicted to opioids after receiving the drugs for a medical condition, says Dr. Scott Gottlieb, commissioner of the Food and Drug Administration. In response, the agency has taken steps in recent months to better educate medical providers on the risk and benefits of prescribing opioids, he said. Dr. Collins of the National Institutes of Health said more emphasis must be placed on alternative treatments such as acupuncture, which might be effective in treating pain and could keep people from getting addicted to drugs. Democrats on the committees charged the Trump administration has delayed critical steps that could provide relief to families suffering from opioid addiction, even as Congress has authorized nearly $1 billion for states to address the plague. The administration has proposed slashing the budget for substance abuse and mental health programs, allowed the Justice Department to treat addiction as a criminal justice issue, and attempted to end the Medicaid expansion under Obamacare, which would eliminate insurance coverage for millions of Americans with substance abuse disorder, said the committee's top Democrat, Senator Patty Murray of Washington. We should be doing everything we can to tackle this crisis and push for actual results, Murray said. And critical to all that is this administration being a partner and not a hindrance to our efforts. Next month, the committee will hear from state officials about what they are doing and what resources they need to combat the opioid addiction. All right, ladies and gentlemen, let me go ahead and give you my commentary on this whole thing. Number one, these people have been in place for a long time. These are not newcomer officials, newcomer senators and congressmen and even doctors that are running these top agencies like the CDC. Yet these addictions and these overdose deaths continue on. Because of the climate in America when it comes down to race, you are not going to see things for what they really are. If you want to beat this opioid plague, rich people are not your answer. All of these people in charge, these officials and these people with these fancy titles and these senators and even this guy, Scott Gottlieb, these are all multimillionaires. The opioid plague has been going on for nearly 20 years. If these people were the answer to that problem, you would have seen it by now. It don't take 20 years to see it. Now, this guy alone, Scott Gottlieb, the one that is heading the Food and Drug Administration, go look at what he did prior to getting this job. This man promoted the use of opioids and worked for big pharmaceutical companies and made millions off of promoting the drug. Trump took that man with that kind of background and made him the head of the Food and Drug Administration. Do you really think with that kind of background he's going to turn on the people that has funded him all that money over the years for speaking and selling opioids to the public, giving speeches all around the country on how great opioids were, and the pharmaceutical companies were propping him up and paying him millions? Do you think this is the person that's going to resolve your problem? And then look at some of these senators and Congress people. Pat Murray, Susan Collins, there was somebody else in here, Susan Collins. But my point is, these people have been in Congress for decades. Decades. And this plague has gone on for nearly 2 decades. I'm just telling you, these are not the right people to head this plague. If you don't want to see it, that's only because you just want to see a white face at the top resolving this whole thing. And I'm telling you, it's not going to happen. It's not going to happen. None of the people in this article, none of them have ever taken a hard stand against pharmaceutical companies or getting drugs off the street. And if they did a lousy job, because drugs are still heavy on the streets all throughout America. And this opioid addiction is still going strong. In fact, more people are becoming addicted every day than getting off the drug altogether. Until you realize the people that you got heading your CDC, your Food and Drug Administration, your Congress, and your Senate do not have your best interests at heart, nothing is going to ever change about this plague. Number two, you've let it spiral too far out of control. And then you have President Trump, who's an elite. You got Jeff Sessions, who's a hardcore racist. These people can't even see things clear enough to get this whole thing resolved. So you can be mad at me for voicing my opinion. What is that going to do for your opioid plague? Not a thing. You don't have to agree with me, but I'm just telling you. All of these people that you got in charge of this opioid epidemic do not have the capacity or mindset to resolve it. Rich people will not be your answer to resolving an opioid crisis in America. You can take it or leave it, but I put it out there. Please leave your comment and subscribe. And if you can make a donation to my channel, please do. And those of you that have made donations over the past few days, I just want to say I deeply appreciate it. Peace, family.